Okay, welcome everybody. Welcome to the DOPS Practice Monitor WebEx for early May 2016, representing emerging trends from the DOPS Practice Monitor, with updates in hemodialysis care with data through the end of December 2015. And we thank you all for joining us this afternoon. I'm going to walk through some logistics, first of all, before we move into the content of this afternoon's presentation. Okay, and actually, just a note, I'm Bruce Robinson, the lead investigator for the DOPS program, and I and 3 or 4 others on the DOPS team will present the topics for today. Okay, so first of all, just to note that CNE credits for this web conference are available. Evaluation form is available at the Nephrology News and Issues website, as noted. And special thanks as well to Nephrology Clinical Solutions for providing continuing education credits. These slides will also be available at the end of the WebEx for download and or for if you'd like to check this information again directly from the DOPS Practice Monitor website. All right, so learning objectives for today. Number 1, to explain the U.S. DOPS Practice Monitor as a tool to understand current trends in U.S. hemodialysis care. Secondly, to describe recent trends in U.S. hemodialysis practice using data that we've just updated through December of 2015. And lastly, to discuss some of our newest findings, in particular, the uptake of Mircera in the U.S. DOPS sample. Okay, we actually have 2 series of questions, and those are available right now, Brian, on the side of the WebEx screen. You should see these questions up. The first sequence of questions relate to the use of vitamin D, and there's been an important and interesting transition in a number of facilities, quite a large number of centers, dialysis centers in the States, from IV to oral active vitamin D, in particular oral calcitriol. And so our first question, in your practice, are any patients prescribed oral active vitamin D, such as calcitriol or rocaltrol? In the past year, have patients been switched from IV to oral active vitamin D? Thirdly, do you anticipate starting oral active vitamin D for more patients in the coming year? And if so, we have some answers that allow one to choose between whether this might be as an addition to IV vitamin D or instead as a substitute to IV vitamin D. And then fourthly, we're also interested in where oral vitamin D is administered. Our understanding is we recognize that in some centers, oral vitamin D is directly observed therapy essentially within the dialysis unit, whereas in other cases the prescription is given for home use. Okay, the second series of questions relate to session length and also actually some vascular access questions. Number 1, have there been changes in your typical dialysis session length in the last year? We give options for longer, shorter, or no change. And then have there been changes in your typical blood flow rates? And in this case, to make all things your patients equal, as it were, we're talking about patients with an AV fistula. Have blood flow rates typically risen, declined, or stayed about the same? And we're also then interested in again, vascular access, but in particular here among incident dialysis patients. So just interested from the audience, to your understanding, what proportion of hemodialysis patients start outpatient dialysis with a catheter in the United States? So, and by start outpatient dialysis, we mean incident chronic dialysis patients. And then in addition to that, what do you estimate is the percent of patients in your unit who start chronic dialysis with a catheter? Okay, and once again, these 8 questions are actually up on the WebEx on the side of the screen for you to answer during this session. So thank you again for your participation. Okay. Well, I have a couple more introductory slides, and then the rest of the agenda is listed here. Ben Sutton will describe some recent website changes and enhancements. I'll focus on some of our new data elements that we've introduced. Dr. Tintori will speak about dialysis dose, session length, mineral bone disorder highlights, and Doug Fuller will speak to shifts in ESA treatment, and in particular a change in a number of units to the use of Mircera. Just a few introductory slides related to the DOPS Practice Monitor itself. And before getting rolling with that, I'd like to acknowledge the support of our industry organization sponsors, principal study sponsors, including Amgen, Baxter, Kyohaka, Kirin, and additional support for specific DOPS countries or project-specific support as listed here, in addition to public funding support for a number of ancillary DOPS program studies. Okay, and this is a slide that we've used actually for a number of years. We launched the DOPS Practice Monitor on the left-hand side of the slide in mid to late 2010, prior to the introduction of the new bundle payment system, which folks on the phone, I'm sure, are intimately familiar with at this stage. And the new bundle payment system was launched in January 2011. Following that, important label changes to ESAs, which led to substantial changes in anemia practice in the states that we've reviewed at some length before. But as well, all sorts of substantial policy changes over time, including introduction of the QIP, much more recently the launch of the ESCO demonstrations, the launch of the star rating system a year or so ago, as well, the CMS star rating system, and continued discussion and/or discussion with respect to bundle rebasing. The bundle is the current base is to remain unchanged through 2016. The primary point from our perspective is that there remain substantial changes to dialysis policy, in particular reimbursement and quality metric-related policy that may influence hemodialysis care. In addition, the introduction of new products, as we've seen with meaning and mandating the necessity of close follow-up with respect to changes in practice. And to that end, the DOPS Practice Monitor, I have a screenshot from the face page for the DOPS Practice Monitor, again, showing trends in multiple dialysis practices. We have over 500 graphics and tables here, again, with data from August 2010, before the bundle, right up until December of 2015. And we do update this website 3 times a year, major updates 3 times a year, with data that will be lagged by roughly 4 months. On the front of the website, you'll see key featured measures or measures that we think are of particular interest to the community, measures and/or medication use, transfusions, etc. But a lot more data if you browse within some of the tabs on the website. And as well, underlying data tables for all of our graphics as well.